Yes, ma'am.
Okay, perfect. Awesome. Okay, so I think that's all I needed. Primary concern, kind of goal with everything. That's great. Okay, so what I want to do is dive in from, we'll ask some questions really from early childhood. If you don't know the answers, totally fine. But it gives me a good idea of some muscle, breastfeeding, all that good stuff that goes into all this. So no worries if you don't know any of these answers. And if you're wondering, what does that have to do with this? How is that connected? Just jump in and let me know, okay? So diving into your early childhood, do you know, were you breastfed or bottle fed or a combination of both?
No bottle.
No bottle. Okay. And do you know for about how long you were breastfed?
Oh, at least a year and a half.
Okay.
My mom nursed for us for a very long time.
Okay. Awesome. Do you know, did she have any problems nursing you that she brought up with you ever? Pain, latch, milk supply, anything like that?
Mm-mm.
Perfect. Okay. Do you know if you were premature at all?
No, I was late. All
Late.
of her five children were late, and I was a very chubby baby, so I'm assuming that nursing went well.
Yes. Good. Excellent. Okay. Any complications during birth? Were you born through C-section or vaginally? Perfect. And any complications that you remember her talking of, forceps being used, anything like that?
I don't think so.
Okay. Awesome.
Fourth of five, so the way had been
A
paved
little bit easier. Yes.
for me.
Big family. Okay, any oral habits that you remember seeing yourself doing as a child? So finger sucking, thumb sucking, when you were little that you remember pictures of, or your mom ever saying anything?
No, I don't.
Okay. And any pacifier use, either up until the age of 1 or prolonged past the age of 1 is what we look for. Anything like that?
I don't remember any pictures with pacifier.
Perfect. Okay. And as an adult, do you feel like you have any weird oral habits like nail biting or chewing on the ends of pens? Anything where you're like constantly wanting to put something in your mouth?
But I tend to I find myself holding my jaw in weird positions. And I'm like,
Okay.
wait a second, what am I doing? Like I'll like pushed forward or something with my tongue in between or something like that. And then I try to put everything back where it's supposed to be. I'm asking my mom if I used a pacifier.
Perfect. Yeah, let me know. So how often do you find yourself wanting, is it usually wanting to push your jaw forward?
Yeah. I think
Mhm.
when I catch myself, it's usually that I'm pushing it forward.
And how often do you feel like that happens?
Um, Depends on what I'm doing, but probably like often, eight times
Okay,
a
at
day.
least daily. Okay.
Yeah, multiple times a day.
So sometimes we see that often with, and we'll talk about airway and sleep and you know, if we think there's any actual airway issues or sleep issues or breathing. But we see that very often when we want that jaw to like fall in, it's not like in the correct ideal anatomical place. And so we're trying to push it into that place and we want it to go into that place, but we can't quite make it stay there because everything's not lined up, right? And so we see that sometimes with TMJ, which we know you have, but sometimes also we see it really common with trying to open the airway and trying to push that jaw forward and open that airway a little bit more. So that's actually a really important thing to pay attention to. And I'm glad you brought it up. And you said teeth in me or tongue in between your teeth also.
Sometimes, yep.
Okay. Any history of speech problems, speech therapy as a kid, any lisps, anything like that that you remember? Okay. Okay. Any history with ear, nose, and throat doctor? Do you still have your tonsils and your adenoids, or have those been removed?
I do have tonsils, but I had strep throat nonstop as a teenager.
Okay.
So if we had had the money, I probably would have had my tonsils out, but we didn't have the money. So
Okay. And now has Dr. Brown, has your husband checked your tonsils when you're in there? Are they a normal grade? Has he ever mentioned them? Anything
he's
today?
not mentioned them.
Okay.
They aren't big, but they look patchy and damaged.
Okay.
Oh, also, this started happening like a year and a half ago, when I leaned forward to put my makeup on, these muscles right back here,
Mm-hmm.
it's so tight and
Okay.
it hurts. It drives me crazy.
At like the base of your skull in there.
Yeah, sorry, my cat
Oh
just
no, that's fine. I was like, I thought I saw a
climbed
cat.
on my
A minute.
um yeah, it's like right here.
Okay. That's anytime kind of leaning forward in there. Okay.
Oh, that's why
Um,
I asked for a makeup mirror for my birthday because when I lean forward, it bugs them.
really bugs. Okay. Get a magnifying one. Okay.
Yes, but then we still haven't installed it, so it's not doing me any good.
Okay, I'll notate that. Um, any um surgeries on your nose, deviated septum, anything to that extent? Any chronic ear infections as a child or as an adult?
No, I got throat infections
Okay.
more than ear infections.
Okay.
I just got done with an ear infection a month ago, though.
Oh
First
gosh.
one I've had in a long time.
Oh, that's the worst. Okay. Any history of asthma?
No, but I used to feel like my throat would get tight when I would run.
Okay.
Um, and so it kind of sounded like I had asthma, but I think it was more of an airway issue
Okay.
now that I know that. But
Mm-hmm.
I tried the kids' albuterol
Mm-hmm.
to see if it would help
Mm-hmm.
when that would happened, and it did not
Okay.
do anything. So I think it was more of an airway issue.
History of allergies, like seasonal allergies, pollen, dust. Do you deal with stuff like that every year? What does that look like for you?
No, my kids and my husband have a lot of seasonal environmental allergies. I really just have more skin reactions than anything. That's what I've struggled with. Um,
Okay.
nickel I'm allergic to, and um, yeah, it's always been skin reactions,
Mhm.
dermatitis type stuff.
Okay.
Never here.
Perfect. Okay. What about food allergies? Anything?
No, although I suspect that I have some pretty good food sensitivities
Okay.
just because of digestion issues
Okay.
always. But I'm working with an immunology guy to try to fix that for
Okay.
myself and for the kids. So
Okay. Any history of seeing a chiropractor often for like any of the neck or the back? Um,
I tried to get my upper back to get better. I went to a chiropractor religiously twice a week for 2 or 3 months without any
didn't do
effect
anything.
on the
Okay.
upper back. Yeah.
Okay.
And then I went to a massage therapist, and that was years ago. And then here I went to a massage therapist that also does TMD work too, and he would stretch and stuff all the things all inside and around my mouth so that it wasn't tight.
Mm-hmm. Okay.
It didn't really help.
Didn't help. Okay.
Not really.
Anything with acupuncture, myofascial release, osteopath work?
Nope.
Okay. All right. Now tell me your history with braces and orthodontics. Was the Invisalign, was that your first entry
Mhm.
into orthodontics? Okay. And how long ago did you say that was?
I believe that was in about 2016 or
Okay.
17-ish.
And was correct, it was like cosmetic kind of the
All
main
cosmetic.
reason?
It was to bring these
Those.
back and these,
Okay.
yeah. So that, and I have not been retaining since. I've just been trying to keep my tongue up there. And so they've
Mm-hmm.
come back up a little bit,
Mm-hmm.
but not as
Okay.
bad as before.
Okay. And was anything else really crooked or crowded on the lower, anything
Oh
like
yeah, the
that?
lowers were crowded.
Were
They
crowded.
weren't ever when I was younger, but they started to be crowded. And so then they started wearing down.
Mm-hmm.
So that was also part of our goal, was to get that to
Okay.
stop. I forgot about that.
Okay. So no history of like palatal expander, headgear, anything like that. Okay.
Nope. We had no money, honey.
Okay.
Growing up, we didn't do anything except unless we were dying.
Yes, I understand that. So dental, any history of periodontal disease?
No, no. When I first, this is gonna sound horrible to you, but I wasn't ever taught to floss my teeth, only to brush really good, which I did
Mhm,
religiously.
mhm,
But I never flossed until he was in dental school, and he came home and he's like, you know what? We should floss. And I was like,
mhm,
okay.
mhm.
So
Okay.
before that, I remember I went to a hygiene school to get my teeth cleaned because we never even went to get our teeth cleaned growing up.
Mhm,
We just have really good teeth, and our parents told us to brush our teeth really good. So we did,
mhm,
but we just never went to the dentist. We didn't have the money to. So I remember that when I would brush, I would get bloody gums every once in a
mhm,
while. I just
mhm,
thought it was normal.
mhm,
And then the hygienist was like, you know, that's not normal, right? And I was like,
mhm.
no. So, so then I started flossing later, but that's the closest that I've gotten to that was,
Okay.
yeah.
Okay.
And now I haven't
Um,
skipped flossing since because I think it's disgusting.
right.
So
When
gross.
you learn, more you know. Any extracted teeth? So wisdom teeth.
Oh, my wisdom teeth. I only had uppers. I never had lowers.
Okay.
And so, but my uppers were extracted before
Okay.
before he even thought about being a dentist. I was, let's see, that would be Trinlee, Taya was a baby, so that would be 16, 15 and a half years ago.
Okay. And just extracted because there wasn't enough room. They weren't coming in right.
I kept feeling this weird like thing happening, like they were
Mm-hmm.
moving
Mm-hmm.
and they were bothering me, but I mean, now that I look back at it, it probably was TMD because
Okay.
I was tired. I had had a baby,
Mm-hmm.
like 5 months before, and I was
Mm-hmm.
exhausted, and I had a 2 year old, and I
Mm-hmm.
think I was clenching a lot at night, and so it was bothering me. And so
Mm-hmm.
I went into the dentist, and he X-rayed, and he's like, "Well, your wisdom teeth are still in up there. Let's take those out." And I was like, "Okay." I
Mm-hmm.
didn't know any better.
Yeah, and after you had the wisdom teeth out, what symptoms changed? Did your TMD get better? Did they get worse? Did
I
that
don't
feeling go
even.
away? You can't even remember. Yeah.
I don't. I did. There was nothing remarkable.
Okay.
I was just trying to survive with two small children. So
Oh my gosh. Yes, I get it. So what year was that of the wisdom teeth removal?
probably 2007 because she was
Okay.
born in 2006.
And if you had to kind of guess when TMD started really acting up or when you started noticing that, could you pinpoint like a time of that?
The trick is that I didn't know that the symptoms I was experiencing were coming from
Word.
that
Yeah.
until we
Mhm,
learned more about it, because most people don't realize that
mhm,
what they're feeling
mhm,
can come from their jaw.
mhm,
But I do remember that once I started having kids, like when Kai was born, I noticed a lot more upper back, neck, and headache issues.
okay. Mhm,
I mean, obviously, I was holding a big, heavy baby
mhm,
and nursing him, and I was exhausted, so I think I was clenching more, and I was
mhm.
so I if I could pinpoint something, I would say then.
Okay. And what
I
year was
don't
that
know.
around?
Well, he's 18 now, so that would
Okay.
be 2004, 2005.
Okay. The reason I ask is sometimes we see when we get upper wisdom teeth, especially removed, we see an onset of like TMJ issues because it collapses our palate more back there and it changes the rotation of our jaw joints. And so where we were sitting a little bit, the wisdom teeth actually kind of help stabilize everything out, widen the palate, support the airway. We can't always keep our wisdom teeth. I'm not somebody who's like, keep them no matter what. But we do see, and I'm a victim of this too, it kind of happened to me. When those wisdom teeth go, it changes how your bite sits and it changes the rotation in the jaw joints and it collapses the palate a little bit more. So we see a little bit
Interesting.
more airway issues. We see a little bit more jaw problems. And so
So
sometimes we
where
can
they
kind of
recommend to
pinpoint what the
always
reason
get wisdom teeth out, is that maybe not the best recommendation? Because they say, like right now, in general, they say get your wisdom teeth out when you're a teenager, just do it so that they
is.
won't bother you later. Is
Mhm.
that not necessarily, is that one of the many things that is not necessarily the best thing that's a tradition in dentistry?
Right. So yeah, so I disagree with that outlook of it, that and it's very common, like you said, like you turn 15, 16, 17, you're going to get your wisdom teeth out. That's the way it is.
Huh.
But we really need to start looking at it from person to person. If we can start like myofunctional therapy and expansion and all of these things from a young age, myobrace, all of those patients have a much greater chance of developing the appropriate palate size to keep their wisdom teeth, right? Now, we wouldn't want to keep our wisdom teeth if they're partially erupted and they're causing gum problems and infections and things like that. That's a case
Or
where
if
we
they're pointed, like pointed toward the
Mhm.
roots or
Yeah,
something like that.
if they're gonna
Interesting.
interfere with the
We
teeth and
probably
pinch
wouldn't
them.
have removed, so we removed Kai's wisdom teeth ages ago,
Mm-hmm.
or 3 years ago.
Mm-hmm.
And I wonder if that made his worse as well. That's
Yeah.
interesting.
And
He
so
has
we
a
see
really
and so
big palate. Like all my kids have a pretty big palate.
uh-huh.
I'm sure it could get bigger, but
Mm-hmm.
we don't have little mouths.
Yeah,
So that's
which is
like,
great. Yeah. Yeah. So if we can keep them, if they can come in healthy, and they're not impacted, damaging other teeth and,
right,
infections, then we
right.
want to keep them. There's quite a few studies done out there, and there's a really cool study done in the NFL, that shows players who have their wisdom teeth or they created mouth guards that acted like put things back there that acted like wisdom teeth, and they have less rates of concussion. And so not only can it support our palate and support our jaws, but it can also help support our brain. So it helps kind of spread that impact. If we were to have that impact, it helps spread it across the occlusal plane. So we see it protects our brain. So there's a lot of reasons why we actually have them. And I was in that situation too, where my upper ones came up totally fine. My lower right one was totally fine, but my lower left one was slightly impacted and it was causing gum problems. So every time I would chew, food would get stuck in it and it was irritating. So
Hard to
that
keep
one
clean,
yeah,
infected.
so that one did need to come out. But their thought was I was just out of hygiene school. And they're like, well, while you're in there, let's just remove all of
Just
them.
do them all. Yeah.
And so we removed all of them. And now that I look back, that's when my TMJ issues, my clenching, grinding issues kind of started coming into
Interesting.
play. So it is
Interesting.
interesting to look at when we're looking
So my
at wisdom
uppers were
teeth
still up in. They hadn't come down yet.
hadn't come down. Yeah. Okay.
They're still impacted. Um, so I don't know how much it affected it, but
Yeah, yeah, and sometimes just the surgery itself too, we see, undergoing things like that. But any other missing teeth, premolars, anything else besides wisdom teeth?
mm.
Okay. Any common dry mouth, chapped lips?
Dry mouth and throat constantly, no matter what I do, even if I'm breathing out of my nose, which is
Okay.
interesting. Get dry at the back of my throat. So I have to jog with gum in my mouth, or
Okay.
else my throat dries out, and I have to sleep with those Xylamelts.
Mm-hmm.
You know what those are?
Mm-hmm.
I sleep with those or a sugar-free cough drop in my mouth every night, or else I wake up with a completely dry mouth and it's horrible.
Okay.
Yeah, and
Any
that might have to do
connection?
with some medications that I
That's what I was
take.
gonna ask. Any connection with medications or
It likely, but it also happens during the day, and I take most everything at night, so I don't know.
Mhm. Yeah, okay. Eating habits. Do you find that you eat really fast, really slow? Just kind of normal, nothing you
I am generally have been for most of my life a very fast eater,
okay.
and I have to make myself slow down.
Okay.
So I tried to slow down. I also tend to like really like I'll catch myself, chewing gum or chewing food like really hard. Like
Okay.
like really pushing down hard on that. Um, and tell myself, you don't need to relax a little bit. I tend
Mhm,
to just like
mhm.
kind of how I
Just
go at
slow.
life.
Okay.
All the,
Yeah.
is just like, let's get her done, let's do it.
Okay.
And I kind
Yeah.
of approach eating that way too. And I've had to force myself to slow down and enjoy and like not chew so hard and everything like
Mhm,
that.
mhm. Okay. Any problems with like swallowing pills, vitamins, medications? Do you choke or gag often?
No, although I've never had a problem with it. I mean, I can swallow like 8 pills at a time and I'm fine
Okay.
because I take a lot of
Mhm,
supplements and vitamins and
mhm,
stuff.
mhm.
But in the last few months, I've had problems with them getting stuck on the way down.
Okay.
Really weird, where I've never had that before. And that also kind of coincided with this getting worse too. So I don't know if maybe my airway got worse before I got this new orthotic in, and so it got worse and worse. I don't know.
Okay.
But that doesn't seem to be happening now, but it did for a little while.
Okay. But now it's kind of back to normal.
Think so, yeah.
Okay.
Close.
Um, Mostly. Any problem like when you're drinking water, choking on water often, anything like
All the
that
time.
all the time?
Yeah, I will even on my own saliva, it'll go down the wrong tube, right? Right back here,
Uh-huh.
constantly. It's horrible. I told my husband I'm probably gonna die from I'll probably die from either colon cancer or throat cancer or choking
Or choking.
because of my digestive issues. And then that I just am like constantly choking. I don't
Well, let's
know.
see if we can fix the choking one on our end. So maybe
Feel.
we can do that. Yeah. Strong gag reflex, gagging a lot when brushing teeth, anything like that. Okay. Any problems with acid reflux?
Yes, horrible. I have my whole life since I was a child.
Okay.
And I got on omeprazole when I was about 23, because they did the thingy where they looked down and he said that I did have a lot of scarring there, and that if I didn't get on something that I probably would end up with throat cancer, like my
Okay, so that's why
my
you
great
took
grandma
it.
Jessie died of throat cancer.
Oh gosh,
And
okay.
and she had the same issues. And so this is where I've been trying so hard for like my whole life to target what is it, like what food sensitivities do I have or what things
Mm-hmm.
are causing this so that I can get off of the omeprazole. But
Mm-hmm.
thus far I've been unsuccessful in every attempt, so I'm still on it, which is unfortunate. And I will still get it through the omeprazole,
Okay. Is it worse in the
sometimes.
morning or at night or with certain foods? Does anything like make it worse?
Um, it's usually worse in the evening, but I also take my omeprazole in the morning. But sometimes in the morning, right after I take, all my supplements and stuff, sometimes just like taking the supplements, sometimes will just trigger it.
Mm-hmm. Do you ever have a constant feeling of like phlegm or like a blob of like mucus in the like in your throat often, anything like that?
But Taya does.
Okay, it does. Okay.
I don't, not really.
Mm-hmm. The reason we talk a lot about acid reflux from baby up to adult, we see acid reflux in babies, really linked to tongue tie and swallowing and things like that. But there's
Hmm.
some interesting studies out there that link acid reflux to airway and sleep apnea and sleep and breathing problems at night. So,
Really? So
um,
Trinlee has a lot of acid reflux, and Taya has a lot of phlegm and stomach issues. So that's interesting.
okay. Yeah, so we'll dive into that. I'll show you over the studies so you can look at them. It sounds like you've tried a lot of different things, but we know.
Any studies that you talk about, I would love for you to send them all our way. We want to read
Okay,
all of them.
yeah, I'll just send my entire kind of
Yeah,
library
whatever has
over
been
to
like
you guys.
really impactful for you, that would
Okay.
be, I would love for it to your whole library. We'd just love to study it all. It's hard to sort through and find the best stuff. And if you've already
Mhm.
done some of that, that's super
Yeah.
valuable. Thank
Yeah, I
you.
typically have one or two for like each major thing that people see us
Right.
for, Meyer brace, things like that. There's tons out there, but So yeah, I'll shoot that your way. It'd be interesting to look into more with airway, acid reflux. We already covered headaches, migraines, all of that, neck pain, shoulder pain, TMJ, we already got that. Okay, sleeping. When you sleep on your back, your mouth falls open. It's hard to keep
As
closed.
soon as I relax, it will
Which
just,
relax. Okay.
my tongue slips to the back of my throat and close,
And-
and like it all just closes off
yeah. Okay.
and then wakes me up. So I always sleep on my side. And then I try to start in the right position with my teeth open, my lips closed, my tongue, on the roof of my mouth. And
Mhm.
then I'll support my jaw a little bit because I feel my jaw's just always really tender. And so even if I'm on my side and I relax and it goes like this, it will start hurting a lot. And so I try to support it with the pillow or even with my hand like this when I fall
Mhm.
asleep to prevent that.
Mhm.
But
Okay.
still, I'll wake up really tight sometimes.
Okay. Do you snore at all?
Not a ton, but I do,
Okay.
especially if I'm on my back.
In your back more. Okay. Do you feel like you wake up rested? If you get 7 to 8 hours of sleep, are you waking up rested? No. Okay.
Sleep issues have been so definitely run in my family. Kai and Trin and I we all take stuff to be able to sleep,
Mm-hmm.
to settle the ADD brain down a little
Mm-hmm.
bit.
Mm-hmm.
So
Okay.
that's always been an issue. But even so, that helps me to fall asleep. But I still never feel, I just don't feel rested when I wake up, especially with my jaw. I just don't feel rested at all.
Okay. Hey, if you sleep on your side, do you feel like you're pretty successful the entire night breathing out of your nose or not necessarily?
Sometimes,
Sometimes.
sometimes.
Okay. Have you ever had a sleep test?
No.
No. That might be something it'd be really interesting looking
I mean, I wore a
into.
watch for a little while and it told me that I
Uh-huh.
was getting bad sleep. I was
Yeah,
like, I already knew that.
I already knew that. I already know that. Yeah.
I could feel that.
Yeah, it'd be interesting to see actual, yeah, like are you obstructed, is it obstructive sleep apnea, any upper airway resistance syndrome? We know 70% of the time patients who have TMJ issues also have sleep apnea or upper airway resistance syndrome. So it's a pretty big percentage in there, of a possibility. And with some of the other symptoms that you're kind of pointing to, it'd be interesting if it is something more going on that could be connected with,
About a sleep study at
like,
home.
yeah. Yeah. So I think we briefly chatted about,
We
um,
did, about being able
yeah.
to send those home
hmm
with people.
Yeah. So I could, if you wanted to like try it, and
Hmm.
there's some doctors in Denver, dentists, that I work with, that will sometimes mail them out to patients and things like that. So we could, if you wanted to try one out, we
To just
could,
try it out.
yeah,
Yeah.
have it mailed to you. You could try it, and then be beneficial for you guys to see if it'd be interesting for your office. There's a couple different types. One that kind of goes on the wrist and a lead and a finger. Some people just do a ring. So a couple different options in there, but I think it'd be really interesting to see that on you. Especially with some of those symptoms. I think it'd be good to get just a baseline. We obviously have some airway issues and some sleep issues. How severe is that? Would be
Yeah.
really good to look at.
I'm open to that.
Yeah, we know, this the statistic is 60% higher risk of heart attack, stroke with untreated sleep apnea. And I'm super passionate about it because my grandpa passed away at the age of 57 from a heart attack, and he had severe untreated sleep apnea. So I always bring it up. But
Oh yeah,
uh,
that's a good
yeah, yeah. So
preventable.
definitely worth looking into. And the sleep tests are pretty affordable. I think most of them like around a
And
hundred bucks.
they're affordable and they're not invasive. So it's
Yeah,
kind of like,
and
well,
and it makes
yeah.
it easier when you don't have to go into a center and try to do all that. So let's look more into that. I think that would be super beneficial. Um,
And
okay.
we can probably get it set up to do at our office too. I don't know if there's a big upfront cost or if it's more like per time, but if you want to
Mhm.
send me the information on those companies, we can look into it.
Yeah, I know WatchPat, which is more of the watch one. I think it's like a couple $1,000s to buy the device. And then you have to buy the replaceables that you throw away after
Hmm.
each patient. And I think it's like, oh gosh, I'm trying to remember, $100 or no, $50 or something to have it read by the sleep specialist, every time somebody does it. The other one, like some of the rings that most of the rings are used by Vivos providers. Those are a little bit cheaper. And if you're going to do a lot of them in your office, they have a really good program that makes it a little bit more affordable. But
Cool. I'll look into
yeah,
them. Thank you.
I'll send those to you. So let's touch on your guard right now, or your do you wear that all the time? Besides,
Yeah. Yeah,
okay, even with
I'm
sleeping,
not supposed to let my jaw come together
come
ever,
back
so I eat
together.
it.
Okay.
This one is made, it's reinforced with metal. It's an orthotic, so it's
Uh-huh.
made to chew in and everything.
Okay. So all the time. And did you notice when you started wearing that, or your first one years ago, any changes in your sleep at all? Worse sleep, better sleep, anything like that?
I don't remember, I'm sorry.
No, that's okay. It's hard to
But
think.
with this most recent one, because that one got broken down so much that I almost didn't have any biting surface left, and like I was in bad shape. We got this
Mhm.
one in, and I did notice that I was waking up with less clenching,
Okay.
and less issues after we got this one in,
Okay.
for sure.
Okay. So during the day, how do you feel like you breathe most of the time? Out of your mouth, out of your nose?
You know, I thought I was a pretty good nose breather,
Mm-hmm.
but I've been paying attention to it lately, and I do tend to have my mouth open a lot.
Okay. If we were to do a test that you had to breathe out of your nose for 2 minutes straight, do you think you could do that without any problems?
Easily.
Okay.
Yeah, actually don't have much obstruction there, like
Mm-hmm.
um my kiddos do.
Mm-hmm.
I have pretty good ability to do it.
Okay. But finding that your mouth's open a lot more than initially kind of thought. So obviously you're aware of what your tongue's supposed to do. If your mouth's open a lot, that would probably mean your tongue is not in the correct position. How easy is it for you to try and get your tongue into the correct position?
So, what is the correct position first? I
Yeah,
think I
so
know.
yeah, so tongue tip. So I'll show you a diagram here in a minute, but essentially we want our entire tongue up into our palate. So it would look like this. And
Okay,
so
that I
do
don't
you
think
guys
so I thought I was having it in the right position, but
Mhm.
I don't have the whole thing up there.
The whole thing up there? Okay.
That's hard.
Yeah, yeah,
I feel like it's stretching and working lots of muscles that I haven't been using.
yeah. Go ahead and open as wide as you can without making the jaw joint hurt. So okay. And then go ahead and just place the tip of your tongue back behind your front teeth. Yep. And touch the palate up there if you can. You can close a little bit. Close as needed until you can touch that. Perfect. And then look straight towards me as you're doing that. Okay. And now just attempt without irritating TMJ, anything like that. Attempt to try and get into that correct position like I showed you. Tongue. There we go. Yeah. Okay. So some overlap. Hold that. If you're fine and it's not creating jaw problems, go ahead and hold that, but stop when you need to. Okay, you can relax in there. How does that feel as you were attempting to hold that?
Like I was getting a workout.
Okay, in what areas? Just tongue or everywhere? Forehead, neck, shoulders?
Here, under my tongue, at the
Mhm.
back of my tongue. Yeah,
Okay.
I agree. I can hear.
Mm-hmm. And did you and Dr. Brown talk about tongue tie, you having some ties? Is that what you had said?
Um, I don't think we've ever really talked about it,
Okay.
but I think I have some.
Mm-hmm. Yeah,
I don't know. You tell me.
yeah, so I would agree. What we look at, we'll do some measurements. I don't actually do physical measurements. We have a tool that like a bite block that we put in our mouth. I'm trying to see if I have mine right here. And each side has specific measurements on it, so depending how high you can put your tongue with that in your mouth kind of gives us a good idea. But we grade it into grade 1, 2, 3, and 4 for tongue ties.
I just
Grade
noticed it. I just noticed I was doing that with my mouth.
Oh, pushing it forward. Okay.
Mm-hmm.
Yep, with the tongue in between
Brought
the
it
teeth.
back. Sorry, I just noticed I was doing it, and so I thought I would
No,
show
that's
you.
perfect. Yeah, no, that's good. And so 4 being the worst, that's very tongue-tied, a tip all the way to the floor of the mouth. 1 is pretty free range, not necessarily needing intervention from tongue tie release, anything like that. You would probably fall into the stage 2 category just by taking a quick glimpse. But if we were to take away the compensations, and there's a lot of compensations that we have to look for, one of your biggest compensation is where the floor of your mouth lifts with your tongue. And so we sounds like that might be a normal thing, the floor of the mouth moving, but the floor of the mouth and the tongue should be 2 separate things. So when the floor of the mouth moves and it pulls everything up, it's connected to what's called fascia. And fascia, I'll show you a diagram. It kind of runs throughout the entire body. And so we see that effect and we see that pull throughout the entire body. So if we were to take away the compensations, then you would probably fall more into that stage 3 category. And what we have to do is we have to see, is it because of a true tongue tie, that tongue is physically tied to the floor of mouth, or is it because you haven't ever used these muscles in this way before? And so it's more of a muscle dysfunction, right? And so looking at it, it's something as we start getting that tongue moving more, we see how your symptoms are going, we see how things are moving. There is a chance to get optimal results, especially with the TMJ, that it might need to be addressed. But it's never something, looking at it right now that, absolutely, until we kind of see how your tongue reacts to more strength, or is it physically
So
tied?
that's why it hurt. I felt like I was straining
Uh-huh.
all in the bottom muscles all around here.
Yeah. Yep, and pulling up in there. So we can see symptoms. I've had patients all the way like plantar fasciitis issues, what they thought was plantar fasciitis, get their tongue tie release and their feet feel better. So it's really amazing how much
Well,
that.
I feel like a lot of the jaw stuff will help a lot of my neck and upper back issues.
Mhm.
And so, but we've never been able to really get it where it's supposed to be. So
Yeah,
this will be interesting.
exactly. One other question that I missed. Do you have any pelvic floor issues? Pelvic floor pain?
Uh, I pee when I jump on the trampoline. Is that
Okay.
a pelvic floor issue?
So 3 kids, yeah. No, we see like pelvic floor pain, like pain with intercourse, like things like that, just
Mm.
like constant like pain and
Well,
um
I have had pain with intercourse, and still have sometimes, depending, but not all the time. And
okay,
then um, I have kind of I don't think that this is pelvic floor, but maybe I have kind of a low grade constant cramping down there, just like kind of always.
okay,
But it might have to do with endometriosis.
okay,
Not, I don't know.
okay. The reason I ask is we see TMJ really connected to pelvic floor, tongue tie connected to the pelvic floor in women who have that issue, but I'll notate that. Okay,
Interesting.
perfect. So let's take a look. I'm gonna have you stick your tongue straight out at me and to the left and to the right. And one more time to the left and to the right. Okay, now just go back and forth for me a couple of times. Any tension in your TMJ when you're doing that?
Anytime I open my mouth, I start to
Okay.
feel it. Like when I was doing showing you tongue started tightening up.
Right up in
Yeah.
there. Okay. Go ahead and take your tongue and stick it just up towards your nose.
I'm gonna move this up because I keep having to like
Oh
bend
yeah,
down
lean
to
forward,
you.
get
So I'm
comfortable.
gonna change my arrangement here. There. Okay, now what?
Go ahead and just stick your tongue up towards your nose and down towards your chin. And one more time up towards your nose and down towards your chin. Okay, perfect. Okay, now I'm gonna have you, can you attempt this clicking motion? Just where you're gonna make a clicking sound off your palate. Okay, perfect, go ahead and relax. Okay, when you're chewing, I won't make you chew food or anything, but do you favor one side more than the other?
Lately, I've been favoring the left side, I think.
Okay. And is that like kind of a new thing?
I don't know. I just noticed the last couple days that when I was chewing, I kept putting it over onto the left side every time.
Okay. So something, just to start thinking about and paying attention to if you notice one side drastically more than the other. And we might see it too when we start doing exercises. We can see that difference show up in a lot of the exercises. But okay, go ahead and whatever drink you have, go ahead and just take a drink. And I'm just going to watch you swallow here. Okay, if you could do that one more time. Okay. And then I want you to think about when you're swallowing, can you describe to me what your tongue is touching? So is it touching teeth? Is it touching palate? Is it touching the floor of the mouth? And you can go ahead and get another sip in there if you need to. Right up in there. Okay.
The front's like that,
Okay.
but it's only the first this much of the tongue that touches the palate.
Mm-hmm.
And then after that, it pushes against my back teeth,
Mm-hmm.
but it doesn't touch my palate.
Okay. Okay. All right. I think that is. So if you had to explain your posture, I know you brought it up. You said more of like a forward head posture or kind of slump leaning in.
Constantly, I do this.
Okay. Okay.
And I'm like, nope, I need to do this. And so then I
Mm-hmm.
straighten myself up, but then I
Mm-hmm.
would revert back to this, and
Back
then
to
I
that.
straighten myself
Okay.
up, and then I
Opening. Okay. Perfect. I think that's all we need here. So obviously, so when we look at myofunctional therapy, 4 goals that we're looking at is tongue positioning, lip seal, nasal breathing, swallowing. And so with you, we know that tongue hasn't been completely up into the palate in that resting position that we like it to. So it's going to be one of our really big goals in there. There's a couple things that we have to take into consideration is one, that frenum in there and the potential that we're probably we have a tongue tie. What degree is it? How much is it going to affect everything? So that's something we're gonna have to think about and really evaluate as we go through. Another thing that we look at when we're trying to get the tongue up into our palate is tongue space. And so does our palate have enough room for our tongue to fit up there comfortably, to be able to pull it completely out of the airway in there? And so we'll know more. Go ahead and get into that suction again. And so I don't know if you can tell or if you can see yourself in the video, you can see that the back part of that tongue is overlapping the occlusal plane
the
between
teeth. I was gonna
the
tell you that
Mhm.
my tongue always overlaps my teeth.
Mhm.
So then
And so
you can see teeth marks on my tongue.
yeah, the scalloping in there. Yep. So what that tells us is that we may not have enough tongue space for the tongue to fit 100% where we would like it to be. So that kind of puts a couple problems or a couple things that we have to think about. Is one, if we don't have enough tongue space, we know that we have an airway issue because our palate's a little bit more narrow. It's not quite big enough to house everything. We most likely have a TMJ issue. We already know that we have that. But if we want to look at long term, how well are we going to be able to keep our tongue up into our palate, out of our airway when we don't have the space for it? Or if we do have that tongue tie and it is affecting things, we may not want to, in certain circumstances, we don't always want to release the tongue when we don't have enough tongue space. Because if we release that tongue, but the tongue doesn't have anywhere to go, then sometimes if we have airway issues, we can make those airway issues worse in there.
That
So
makes sense
something to
because it
think
doesn't have
about.
somewhere to go, so then it goes
It goes
into.
back. And so, yeah, we're releasing it and it has more mobility. But if it can't go up and flat any more than it is right now, we'll see it go back a little bit more. So if you ever run across those studies that, or you hear people say, well, tongue tie releases make sleep apnea worse, there's studies that show it. There are a few studies out there, and it's always
That's
when
why
not enough tongue
it's
space.
palate. Okay,
Yeah. And so really
cool.
important that we look at those kind of few things. So definitely something as we go through treatment, keep an eye on. We'll evaluate all of those things. But we know if we can get that tongue up into the palate even a little bit more, we should be able to stabilize that TMJ, get you not from clenching, grinding, getting in that correct freeway space where the teeth are trying to clench together as much as they are now. So but we also have to take a look that as the more we get that tongue up, you have to pay more attention to your symptoms, because sometimes the more we start to use that tongue and we have that tongue tie, the more we're pulling on that fascia throughout the body. And so sometimes we start to see some of the headaches or the neck or the shoulder tension get worse starting out because our tongue is trying to pull against all this fascia with the tongue tie that it never has before. So there's a lot of things that we'll pay attention to and symptoms as we go through treatment. So a lot kind of going on that we'll continue to kind of monitor, check those symptoms, see how well your tongue is fitting into your teeth, all of those things. Okay. But absolutely, we'll work on all 4 of those goals. It shouldn't be an issue, especially you can breathe through your nose, turning you into a nasal breather, seeing how well we can get that tongue up into that correct position. But I think the number one thing that I think would be really cool and interesting to look into is the sleep study. So I'll get you guys some more information on that and you can look into it. And if you just want to try one out, I'll reach out to some dentists up in Denver and see if you can just do one through them and they can mail it to you or something just so you
Yeah,
can
that would be
kind
cool.
of
My mom said that I took a pacifier, but not very much. I hated it. I only wanted to nurse.
Perfect.
Yeah.
Good. Okay, nursing's great. Okay, so we'll still dive through a lot of education that will cover all of the things that we went over, but do you have any questions for me right now, that your case, what things will look like, anything like that?
Oh, it all sounded let's see. No worries. They're just texting me back and forth about the pictures for the kids.
Oh yeah, no worries.
They're trying to find them, but I'll just take new pictures of the
Okay.
kids.
Yeah,
Um,
yeah, in no hurry. That's fine. Okay, so let's go through one of your kiddos now.
we
And
can start with
then
Trin because she's actually awake and sitting out in the other room, and Kai is still asleep and Tay is at school. So let's start with Trin.
okay, and spell that first name for me.
Trinlee is her full name. She goes by
Okay.
Trin or Trinlee, either one.
Perfect. How old is Trin?
10 and a half.
Just gonna get you in there as the contact. All right. Perfect. So we're just going to go through the exact same thing for her. So 10 and a half. What would be your guys' biggest concern up to this point, or what would be your goals with her?
Goals would be to prevent the problems that her older siblings and I have because we didn't get at it early, to train the correct myofunctional habits so that moving forward she can develop the rest of the way properly. She also has lots of sleep issues. She had bedwetting up till about a year ago, severe. And now she's still, now we've trained her to be able to get up and go to the bathroom at night, which is fantastic. And we did that. I can give you the resource. Dr. Saji from Facebook. I saw an ad and used his device and his program that was automated online.
Okay.
And that's the only thing that ever worked for her.
Okay.
But she still will get up like 4 times at least at night to pee large amounts. We're not talking like little trickle. We're talking like I feel like everything that she pees comes out all at night. It's a huge
Okay.
amount.
Okay.
And so her sleep quality is very low. And for all these things all together, she's so those would be our goals with her, I
Okay.
think.
Okay, perfect. And we'll dive into each of those, her sleep and stuff a little bit more through these questions. So, was she breastfed
Yep.
or bottle fed?
But she also was a thumb sucker and
Okay.
a very intense baby, a lot of screaming.
Okay.
And I think I went clinically insane. And so even though I knew that thumb sucking was not good, that was the only way that I gained any kind of sanity.
Yeah.
We went
Yeah.
with it.
Understood. Understood.
We were
Yep.
we were blessed enough to know that her little pink blankie that we would wrap her in, that's the only time she did it. If she
Okay.
didn't have that, she didn't do it.
Okay.
And so we would give that to her at nap time and give that to her at bedtime.
Bedtime.
And
Okay.
otherwise, we didn't let her carry the blankie around because that's when that thumb went in. So we didn't see a lot of the teeth coming forward stuff from
Yeah.
thumb
Okay.
sucking, fortunately. I mean, I'm
Okay.
sure there was still stuff that happened from it that had to.
Mm-hmm.
But that also made it easier for us to wean her off of her thumb later on. But she did suck her thumb at least on occasion up till 3 or 4, I think.
Okay.
I
Okay.
can't quite remember, but definitely till 2 or 3 with that
Okay.
blankie,
Okay.
but only with the blankie. So
Okay. Okay. And was she breastfed for about how long?
probably 14 months, I want to say.
Premature at all?
Nope.
Vaginal birth or C-section?
Vaginal.
Any complications, forceps, suction?
Nope.
Okay.
Pioneer hips. That's what we call them in my family because in our religion, we're LDS, so
Uh-huh.
we crossed the plains when we were getting persecuted over there. And
Okay.
so anybody who couldn't have a baby while crossing the plains didn't make it over here.
Makes sense. Yep.
So we call it pioneer hips or pioneer stock.
That's funny. I definitely do not have the pioneer hips, so I needed that.
Well, I would have died if I had not because I married a man with a very large head and I have a big head, so I would have died.
Yep.
There's no question. Or C-section, I guess, but
Yep. Any concerns with speech? Any speech therapy, lisp, anything like that?
oh, my kids have all been fantastic speakers. It's been
Excellent.
nice.
Yeah, perfect. Okay. Any history with the ENT? Does she still have her tonsils, adenoids?
She still has her tonsils and adenoids.
Okay. Any history of like issues with the nose, deviated septum?
I don't think so.
Okay. Chronic ear infections at all?
No, but she has ear issues.
Okay.
So,
What type of ear issues?
since a very young age, she has a hard time regulating the pressure in her ears. So does Taya. And
Okay.
so when we would go over mountain passes, she would just cry and cry and cry in airplanes. And so then also she has some allergies and stuff. And so and so when she was ever sick, any kind of congestion along with that, and it was just impossible for her. And she tends to still struggle with that more, I would say, than her peers of
Okay.
regulating that pressure. I do too. And going like to the bottom of the pool, it doesn't bother some people. It really bothers her and I.
Okay. Okay. The reason we talk about ears is we see it connected to our swallowing a lot. So little different
Mm,
with
interesting.
that, but we see
That
so.
would make sense to me because you
Mhm.
swallow to get them to like pressure release. Yeah.
Yeah, so anytime we have a tongue tie or any sort of dysfunctional swallow, we have a higher chance for ear problems. So we see patients who kiddos who are like ready to get ear tubes because they've had so many chronic ear infections. We get their swallow working correctly and their ear infections
Ooh, I
go away.
think that's going to help Taya. We're this close to taking Taya to an ear, nose, and throat
Mm-hmm.
because her ear issues are really bad as far as getting them to regulate and getting them to. She has, yeah. When we went scuba diving, she ended up with a burst eardrum from an ear
Oh, I remember
infection,
you saying that.
and
Yeah.
yeah.
Mm-hmm.
So that'll
Yeah.
be interesting to get
So
her
yeah,
swallowing.
we'll see what the swallow looks like there. Um, any seasonal allergies? I think you said everybody else has them, right?
Bad,
Okay.
yeah, seasonal
Bad.
and to animals. And we're right now doing, and I'll let you know how it goes because he might be a good referral source for you, but he does virtual visits with an immunotherapy that's under the sublingual immunotherapy
I remember you
for
talking about.
basically everything. And so we're still
Mhm.
trying to titrate that to try to help ease some of their allergy symptoms, but that's definitely something that they battle.
Okay. History of asthma.
I don't think so. Although all of my kids have maybe borderline tie the very most.
Okay.
I don't think so.
Okay.
Allergy induced or cold induced. Like if
Okay.
they're already having an immune reaction to something,
Mm-hmm.
then it can, they're like,
Is more.
is
Yeah.
that and
Mm-hmm.
that kind of an asthma sound feeling, that kind of thing, but it's not like a regular like they have asthma thing.
Yeah. Yeah. Okay. Um, food allergies or sensitivities. I think you kind of said you're working on maybe
I
some
think so,
sensitivity stuff
but
with
we're
them.
working on those.
Any visits with chiropractor, acupuncture, myofascial, osteopath?
Mm-mm.
Okay. What is her history with braces, orthodontics, anything at all?
So she was 8, almost 9, few months before 9, when Dr. Baller came to our office and started her on MyoBrace and then
Mm-hmm.
abandoned her.
Mm-hmm.
So she started doing MyoBrace. We saw a lot of big benefits from it. She started being able to wear it through the night without kicking it out, breathing through the nose.
Mm-hmm.
And it helped a lot. And then it did not fix the bedwetting. So then we did Dr. Saji's stuff in August. So she started in like January, February.
Mm-hmm.
And then we did that in August, not of this year, 2 years ago. And um what the interesting thing with the brace and wearing it is that at a certain point, her lower jaw came forward too much and
Mm-hmm.
she started hitting and chipping her teeth. She has chipped teeth now
Mm-hmm.
because they came together and Dr. Baller was not on top of her care at all. And so this is another instance where we just got thrown in baptism by fire into
Mm-hmm.
care that we hadn't researched a lot.
Mm-hmm.
And so we talked with the lady at MyoBrace and she said that sometimes that can happen when the palate does not expand enough
Mm-hmm.
while you're going through the therapy and the other changes are happening. And so we put her in a bent wire system to expand the palate, and that brought that back. So she's no longer having that, which is good. But we just took the bent wire system out and put her back in a MyoBrace for now to try to maintain it. And so she's getting back in the habit right now of wearing the MyoBrace,
Mm-hmm. Okay.
so that we don't lose the expansion that she got. But I'm also hoping that this myofunctional therapy will help her to not lose that expansion that she achieved.
Yeah.
Um,
Perfect. Okay. Good. So no headgear or anything like that that she's been through.
no, she's and she in fact you'll see she has some space between her teeth now from the expander. Um,
Awesome.
and she had fairly straight teeth before that. The
Okay.
crookedness wasn't really the issue. It was more that our knowledge had expanded of what we needed to prevent and
Yeah.
everything. Yeah.
Okay. Any missing, she's 10, any adult teeth that have had to been pulled, anything like that?
No.
Okay. Any complaints of dry mouth, chapped lips?
Yes. And yes. Not extensively, but
Okay.
some.
Okay. Eating habits. Do you notice that she eat really fast, really slow?
She's a fast eater.
Yes, okay, takes after you. Okay.
Yep. And Kai, well, Kai is like Mach 10 eater. I don't think you could ever find someone that eats faster than he does, but she's still a pretty fast eater.
Okay. Um, is she able to swallow vitamins and pills, or does she struggle? She does that no problem. Strong gag reflex at all when she's brushing her teeth, anything like that. Frequent choking on water.
Nope.
Okay. Let's see. Acid reflux. Was she
Yeah.
one? Yeah. Okay. From the time she was born, when did you start to notice?
Well, it's interesting because she was a screamer when she was a baby. So she just was very agitated and not a calm, peaceful, happy baby
Mhm.
at all. It was
Okay.
really hard. And what you might call a colicky baby, although she didn't spit up a ton like Kai
Okay.
did, but she also didn't eat like a pig like he did.
Okay.
And so, uh, but she was just always just so intensely upset. And
Okay.
so I took dairy out of my diet while I was nursing her. She was strictly breastfed, and that relieved some of the symptoms a little bit,
Mhm.
entirely.
Okay.
Um, and I don't know how much of that is just general personality because
Mhm.
the anxiety and the intensity that she tends to have,
Mhm.
it was already there when she was
Was
born
already there. Yeah. Mhm.
versus some other thing, what other
Mhm.
things it could have been.
Absolutely. Did you struggle nursing her at all? Any pain, loss of milk supply,
So I
reaction?
I definitely went through some postpartum depression. I didn't know I was going through it at the
Mhm.
time, because of the dynamic of everything,
Mhm.
and I went a little bit overboard with
Mhm.
a focus on weight loss
Okay.
after she was born. And
Okay.
so I restricted my calories
Mhm.
and what I was doing and increased my activity level, and I got kind of
Mhm.
obsessed with it a little
Mhm.
bit. And I did lose my milk supply, and she got even more upset when
Mhm.
that happened. But it was for a short period of time.
Okay.
And then I was told by someone to eat a ton and drink a ton and to knock it off. And so I did for a little while, and it came back, and then it was fine.
Okay.
And then I kind of regulated.
Regulated. Okay. And any painful latch, anything like that?
No,
Okay.
not really. That was mostly Kai.
Okay. Any complaints of headaches, migraines?
Yeah, she's struggled with headaches more than I think that she should.
Okay. Daily, weekly, monthly?
Weekly, maybe sometimes twice a week,
Okay.
depending on the circumstances. If she's stressed, more.
More. Okay. What about neck pain, shoulder pain? Is she ever complaining like tension or tightness, anything like that?
Yeah,
Yeah. How often? Weekly? Is it a pretty common occurrence?
yeah, pretty frequently.
Okay.
I mean, for a child, I feel like, yeah.
For general, yeah. Okay. Any TMJ problems or concerns that you guys have had, Dr. Brown has had, clicking, popping?
I don't know.
Okay. Nothing that's ever been pointed out or she's never complained of anything.
Um, I mean, no,
Okay.
not really. I think that she was headed in that direction, but I think that we intervened.
Maya brace and all that. Okay. Any clenching or grinding that you hear her do or have seen her do at night?
Mhm.
Okay.
Yeah, and when she wore the Maya brace, she chewed right through the first one, so we had to train her how to wear it during the day so that she wouldn't do that at night.
Okay. And so it went away eventually. What about now? Have you noticed any clenching, grinding?
I don't think so, but sometimes she'll wake up tight.
Okay.
And so that's a sign of that.
Okay. When she's sleeping, we already talked about poor quality. She's waking up a lot. Does she sleep? Have you seen how she breathes at night through her nose, through her mouth? What does that look like?
I've seen her do both.
Both. Okay.
Mhm.
Any snoring that you've noticed? Any drooling?
Yes, both. In fact, she drools a lot. The myo brace makes her drool more too.
Okay. And just not waking up rested. What about during the day? Do you find her mouth breathing, nasal breathing, a combination of both? What would you say?
I would say both.
Both.
She's not a huge mouth breather. She's definitely capable of breathing through her nose, but I've seen her do both.
Both. Okay. Okay, perfect. If she's available, she can hop on and we can take
Yeah,
a peek.
let me run grab her.
Perfect.
Trinlee, we got our myofunctional nervous system. Come on. Oh. We're actually I know she slept there last night while I was wrapping presents. She's so cute.
She only ever sleeps.
Yeah, she's a sleepy kitty. Here, have a seat right here, honey.
Hi, Trinlee. How are you?
I'm not as tall as you.
Let's move this down. Move this down.
My name's Chelsea. It's so nice to meet you.
Hi.
Now, are you the one that broke your arm?
Yes.
Oh my
I am
goodness, how is it feeling?
not broken anymore.
Not broken. Well, good. So feeling better. Do you still have a cast? What's it looking like?
Oh,
Oh, good. Okay. Oh my gosh, your mom's, I saw those pictures and that looked really painful.
yeah. I just got the cast off not too long ago. Week
Oh,
maybe.
good. Good. I bet that feels so much better. Well, what we're going to do here is I'm a myofunctional therapist, and basically what that means, we're going to take a look at your face muscles. So I'm going to have you do a few things with your tongue. We'll do a few exercises, see what everything's doing in there. Does that sound like a plan?
Okay. I
Okay,
just had
cool.
breakfast, so
Oh, that's okay. No worries. Go ahead and start. If you don't mind, just sticking your tongue out at me, Trinlee. Good. And go ahead and relax. And then I'm just going to have you open and take your tongue and go left to right like this, to the left and the right and the other side. And now just go back and forth for me. Okay, go ahead and relax.
I've noticed my tongue is a lot longer than other people's.
A lot longer in there. Does it feel, what makes you notice that? How did you first realize that?
Just like asking if you can touch your nose with your tongue, and I can like do more than just touch it with my tongue, and they
Oh my
usually
goodness.
can't.
Yeah, so that was the next thing I'm going to have you do. Stick your tongue up towards your nose. Oh my goodness. Yes. So you're in the very few that can actually accomplish that. So good mobility there. That's great.
There. It's crazy.
Yes. That's yeah. Let's see your chin. Go down towards your chin. And up towards your nose. And down towards your chin. Okay. You can relax.
There's a tub out there. It's gonna blow away.
See that?
Okay, so now I'm gonna have you, can you open as wide as you can normally without hurting any jaw joints or any pain in here, just like this. Good. And now I'm going to have you, can you take the tip of your tongue, you can close, and put it right behind your front teeth like this. Good, and go ahead and relax. All right, now Trinlee, as you're sitting there, can you describe to me what your tongue is doing in your mouth? Is it touching your teeth? Is it touching the floor of your mouth? Is it touching your palate? A combination of all three?
Do you know,
Well,
do you know what your palate is?
the roof of my mouth.
Roof of
Good
your
job.
mouth? Yeah.
It's like it's touching the roof and my front
Your
teeth.
front teeth there. Okay.
That's just my relaxed position.
Relaxed position in there. And what about the middle of your tongue, which will be like right here? What is that
Yeah,
doing?
it's touching the roof.
Touching the roof? Okay. Okay, I'm gonna have you, can you do this motion? This is just kind of a suction of the tongue up into the roof of the mouth. It looks like this. Really good, okay. That's good, and go ahead and get back up into that position if you can. And your tongue is touching your teeth, is that correct? Okay, go ahead and relax. And what does it feel like if you try to, and it's okay if you can't, but can you try and squeeze your tongue in so it doesn't touch your teeth in there? Can I just see what that looks like when you try to do that? And
Oh,
suction? Yeah, that's okay. Perfect. That's you want to try again? Yeah.
now I gotta get it suctioned. I had it down, but then once you like really try to, you can't.
Uh-huh.
Okay, you got it the first time. I can't suction it
That's
again.
okay. That's okay. It gets tired in there. It's not used to holding that suction all the time, so not a problem. Okay, let me see. Can you just do this for me? Perfect. Go ahead and relax. Okay. Now, do you have something to drink? Do you have just a cup of water or anything with you? If not, do you mind just grabbing something?
Let me get her a drink really quick.
Okay, thank you.
In the living room, my
Is
water
your water
bottle.
bottle?
Yeah.
So Trinlee, you're 10 and a half, is that correct?
Yeah.
What grade does that put you in?
Fifth.
Fifth, all right. Are you on Christmas break or not quite
Homeschool.
yet? Homeschool, perfect. Okay, I think I saw your mom hand that. Do you have something to drink there? Okay, so go ahead, just take a normal drink, just like you normally would. And go ahead and do that again for me. Okay. And then I'm going to have you try something. Can you do this? So it's called a smile swallow. So what we're going to do is we're going to get a little bit of water. Smile. And now swallow. Okay, good. Okay. And now, Trin, I want you to think about what your tongue is touching when you're swallowing. And I just want to get it from your perspective. Is it touching teeth? Is it touching the roof of your mouth? Is it touching the floor of your mouth? Can you describe that to me?
Mostly just the roof.
Roof? Okay, go ahead and do that one more time and just see if that's what you
Yeah.
feel.
Yeah.
Do you feel
Yeah.
like it touches your whole roof of your mouth or just the front or just the back?
Whole roof.
Okay. And then go ahead and just take another drink for me. Okay. And I hope you're thirsty because I'm going to have you do a couple more. Is that okay?
Yeah, that's fine.
Well hydrated.
Yeah. Okay, when you're ready, go ahead and just take another drink. Okay. And another one. Okay. And that feels pretty normal. Like you're not forcing a swallow right now, anything like that. Okay, let me just take a few notes here. Okay, and then go ahead and take another drink for me, Trin. Okay. Just wanted to make sure what I was seeing is happening every time. So you're doing great. How did you break your arm?
So this isn't particularly relevant, but we were having a Halloween party. So it was kind of like the worst time to break it. I mean, it's better than not having someone there to know
Yeah, that's
the care
true.
I needed.
Mhm.
And so I hadn't put my shoes on all the way because I was just kind of trying to hurry outside. And our
Mhm.
porch is raised up by just a few steps.
Mhm.
And I tripped going down those.
Mm.
And I fell forward like Superman did. And my arm caught myself.
Mm.
And the snap
Ugh.
sound.
You knew right away, huh?
I didn't know. Well, I did. That wasn't, I didn't think about that. I wasn't really thinking about anything. I mostly just fell, it broke, and I screamed.
I
And
don't
then I
blame
started
you.
crying. I just
Yeah.
screamed at the top of my lungs. I don't know for how long, but then I started crying and screaming both.
Yeah. Oh, girl, you're tough. That looked really painful. So, okay, can I see you now that your tongue's had a little rest? Can you get back into that suction for me? The best you can. Good. Okay, now as you're doing that, Trent, do you feel any tension or tightness, any pulling under your chin, in your shoulders, in your neck? Does it feel tight or like it's pulling anywhere?
Just like a little bit on the where your tongue goes into the bottom of your
Mhm.
mouth on this side, just like a little
Mhm.
bit.
Yeah, okay. So show your mom, can you get back into that section again? So same thing with her, how much her tongue overlaps her teeth in there and in
Yep.
that tongue space. So same thing we'll want to keep an eye on is are we going to be able to get that tongue completely up in the palate without it overlapping? With her swallow, go ahead and take a swallow, Trin, again. I hope, like I said, I hope you're thirsty. If you watch her tongue right there and do it again for me. If you want, go ahead and take a drink and it comes out right there. Do you see how she sticks her tongue out following her drinks?
Interesting. Yes.
Yeah, I got it
Mm-hmm. Yep. And
to get
sometimes
the
she
stuff
does
on
it.
my lips.
Sometimes she does
I
it
don't do
in
it every time.
not
Most of
every
the time,
time.
though.
Yeah, it seemed like pretty consistently. So and sometimes we see it initiating a swallow too, but sometimes that can be I mean, one, she might be feeling like getting stuff off her lips, but sometimes it's kind of deeper than that, and we see some issues along with that. So definitely want to be addressing that.
It's
How
not.
go ahead.
It's not. It's after I swallow. It's not like part of my swallow. It's not helping me
Noticed that.
swallow.
Yeah. Yeah, it's
I also
following.
noticed
Correct. Yeah.
a little movement right here at the end of the
Mhm.
swallow too, just a little bit of a
Mm-hmm. Yep. And the little, we have some, when she's doing some of the exercises or just moving her tongue, we have what we call overactive mentalis, which you also had. I didn't bring it up. And sometimes this is the chin is trying to compensate for weakness. We typically see it with the upper lip, or tongue tie, or just something where the chin is trying to overcompensate to help other muscles out. And so that's something that we target and we really work on, is to make this chin not do the work of the tongue, not do the work of the lips. We want the lips and the tongue to do that work in there. And then another thing that both of you do, and it's very common that most people do this, is we have something that's called tongue-jaw dissociation, where we want to teach that anything the tongue does, the jaw does not need to do. And so we see this create more TMJ problems, typically not at her age, but definitely if we do this throughout our lifetime, it progresses the TMJ issues, because anything our tongue does, our jaw follows. And so if we're doing this, do you see how my jaw is slightly
yeah.
moving my tongue as opposed to? So just little movements like that, if the jaw is just slightly moving, we know anytime we swallow, anytime we stick our tongue out, any movement with the tongue, the jaw is also doing it with it. And so we're putting more wear, we're using that jaw joint way more times than we need to. And it's kind of compensating for that tongue and trying to help the tongue out.
So the goal is to have the tongue movements completely separate from what the jaw is doing. So okay.
Ideally, yep, that's our end goal. But there's a lot to take into consideration, tongue tie, all of those things that kind of play a role into it. So it's easier to treat the younger because we have less years of building that habit, but it's also harder to treat younger from the perspective of them being aware and feeling that technique when we're doing our exercises. But it's definitely something that we target in there. So, so same thing with her tongue space, definitely something. I would like to see the photos of the palette, see what all of that's looking like, so we can see what that would look like in conjunction of trying to get the tongue up to fill that space up in there now. But same sort of nothing out of the ordinary, nothing I don't think we can definitely help with myofunctional therapy. So dysfunctional swallow pattern, even though it's after her swallow, the initiation and the following kind of all go hand in hand together. Tongue placement, even though it's trying to maybe slightly rest in the palate and is slightly maybe touching the roof of the mouth, it's not in the suction and the full support system that we need it to be, especially with the overlap of the teeth in there. So definitely still offer goals, nothing completely crazy or out of the ordinary that we're seeing though.
Cool, thank you.
So, yeah, perfect. Trent, do you have any questions for me about anything we just did at all? No? Perfect. So I think I'm going to be seeing you again in the future here, and we're just going to work on some fun tongue exercises, muscle exercises, breathing exercises, so we can get the tongue resting exactly where we want it to be. Okay. Does that sound okay to you? Awesome. Okay. Well, thank you so much for hopping on for a few minutes. It was so great meeting you.
Okay. Thank you.
And I'm so glad your arm's better.
Oh, yeah.
I used to work on that.
Perfect. So once I see some of those photos and stuff, like I said, the one of the palettes is kind of most important, so I can see what our chances of being able to accomplish that full palette seal up into the shape of the palette will tell me a lot in there. So perfect. So I have another call at 11:30, so we know we only have about 10 more minutes.
So we can maybe do the other two kiddos today at 3.
Yeah, does that work? Kind of reviewing them, kind of same sort of deal. Okay, perfect. And then, like I said, I usually cover a lot of education, because usually when patients are meeting with me, this is the first time they've ever heard of myofunctional therapy and what is this. So I really like to paint a big picture. So if we don't have time, I know that'll be kind of run into your guys' family time and after school and stuff. We can just cover the kids, and then you and I can just hop on another time if you want, so that I can kind of cover what I usually cover education wise, just to kind of paint a big picture and connect the symptoms that we're seeing with everybody together.
Yeah, if we don't have time today, then another time is fine. Whatever works for you.
Perfect. So we'll plan on we said, yes, 3 o'clock this afternoon. I have it in here. And then while I still have a few minutes, let me just get the spelling and make sure I get everybody in there right. Okay, is it a Kai?
Hi.
Can you spell that? K-A-I?
K-A-I. Yep.
All right. And boy, girl?
Boy.
Boy, how old is he?
18.
18. Okay. So I'm just trying to think. So technically an adult, but do you want me to put him in as an adult? Then you just won't get reminders for his appointment, anything like that.
I would definitely make sure that I have reminders for his appointments
Okay,
as
so
well.
I'm gonna still,
I mean, I would like he's still a senior in high school, so I would like for him to be 100%, but if you want to make sure that he shows up, you might want to also put reminders for me
yep.
in there
So
too.
I'll put you in there as the context still. I just have to do it as the minor. That's totally fine. That works well. Okay. And then so I'm gonna put that down for 3 o'clock. Okay, and then we have, what's the last one?
Taya, T-A-Y-A.
And how old is she?
She will be 16 on Sunday.
Oh, how fun. Getting driver's license or not yet? I'm not sure how that works now.
Yes, yeah. She's had her permit for a year.
Oh, good. Or maybe not. Are you guys scared? Is it a good thing?
Doing really well.
Yeah.
She's doing really well. She's much more of a rule follower than Kai is. Much more cautious. And she's done really well.
Good. Perfect. I know it's always like iffy. I don't know that age. I'm glad.
My biggest worry, we've been lucky we haven't had a lot of icy roads yet. My biggest worry is overreaction in a situation when there's ice on the roads. I think that's or distraction. She tends to get distracted. I think that those will be her, if she ever has problems, I think that will be what it is.
2 big things. Yeah. Yeah, it's definitely, I mean, good growing up, learning, driving the snow, and definitely an asset to know how to do. Okay, so Kai, Taya, 3 o'clock. Are you okay just jumping on the same Zoom link so you can record it?
Yeah, I might send you another one because it will
Okay.
end this one, but I'll send you one
Yeah,
right now when we get off.
One. Perfect. Yep. And I'll hop on that at 3 o'clock and we'll finish the other 2. Okay.
Thank you, Chelsea.
Awesome.
Appreciate you.
Well, thanks for spending your morning with me.
Thank you. We'll see you soon.
Bye.
Bye.